Hello, everybody. We're back at the Central Arkansas Library System with our podcast, and today I'm welcoming Dr. Stephanie Gardner, who is the Provost and Chief Strategy Officer at UAMS in Little Rock. And welcome, Dr. Gardner.
Thank you.
Tell us a little bit about what all that entails. That's a mouthful, and I'm sure it's a busy day for you, but tell us what all the Chief Strategy Officer and Provost at UAMS does in your day job.
Sure, I'll be glad to. Well, first of all, I've been at UAMS for over 30 years, so I've held a lot of different roles, but the role of provost, the provost is over the academic programs and research, and the chief strategy officer my role is to oversee our 10-year strategic plan. And so we have a very ambitious plan. We're about 2.5 years into the 10 years, and the project we're going to talk about today is part of that.
Well, it is an exciting project, and I want to remind myself that we started talking about it. I got involved in this, heard about it as somebody in the neighborhood, probably late 19 sometimes, and I think you had been talking about it or working on it even at that time for several years, you told me. So give us a little bit of the background of how you came to this particular project that we're excited about, because it's going to be right across the street from the Children's Library.
Absolutely. Yes, we have had groups of people over the last decade and a half work on a vision for building a child development center at UAMS. We had one about 30 years ago. In fact, when I moved here, I had a 10-month-old child who was in our child development center at UAMS.
Was it on the main campus there?
It was on the main campus. It was in a building that later needed to come down, disrepair. And since that time, once that program was closed, we just have never felt logistically or financially that we could move forward with one.
How long ago had that been closed?
It was closed around 94, 95.
So it's been a while.
It's been a long time. Yeah, my 10-month-old is 31, so yes, it's been a long time. I think the project really got moving back in about 2007. We hired a company called Bright Horizons to do a feasibility study to look at, did we have enough people that had children of that age that could support a child development center, and what really should that look like for us? And so that ever since we had that report, we've been trying to put together the pieces to make that vision a reality.
I guess one of the pieces is always money.
That's the biggest piece. Absolutely.
So this is about a 20,000 square foot facility, and I heard different numbers when I was at the groundbreaking last week. I think maybe when you were talking about it to some of us in the community 3 years ago, it was $4 to $6 million, but like everything else, it's probably gone north of that now.
It has. It's closer to the $10 million project today.
So that piece is falling into place, or has fallen into place. And I know you've been anxiously waiting to hear word about an American Rescue Plan Act grant that possibly fits this project, right?
Absolutely, but there have been a number of sources of funding that have materialized to make this possible. And one of the things I'm excited about is that the city of Little Rock's been a partner for this and sold us the land for the bargain price of $1.
I think I heard that the mayor or the chancellor said that $1.
That's right. And because that land falls within an opportunity zone, it was eligible for a leveraged loan process that would yield new market tax credits. And that sounds like a lot of verbiage, but basically what that means is that mechanism will yield about $2 million to help support the overall cost of the project.
So that's about 20% of the project.
It is. And we had already saved around $3 million toward this project over the years, and also had some philanthropic gifts. So we're getting closer and closer to meeting that overall number.
Will it have anyone's name? Is there a donor or a philanthropist, or will we just call it the UAMS Child Development Center?
At this point, it's still the UAMS Child Development Center, but if somebody comes forward with a major gift, we will call it that.
All right. There you go. It's some incentive for somebody. So I assume when Bright Horizons helped you put this survey together, one of the things they did in 2007 was ask your staff, your employees, your students, would they utilize this, or would this be valuable to them in their professional lives or in their student lives? How did that come back?
Right. So we were told that we had the ability to support a child development center with about a couple of hundred slots. So this one is designed for 198 children between the ages of 0 and 5. We did also ask them to look at the feasibility of after-school care and elder care, and the feasibility study showed that we probably could not support that with the population that we had. So this one is going to be focused on that 0 to 5 age group, and there's several classes in each age group to equal the total number of 198.
So how many employees do you have at UAMS now?
Probably it's close to 11 or 12,000 now.
So it's got to be the single largest employer in the city.
Yes, yes.
And how many students, if you include the pharmacy students, the med students, the nursing students,
Right.
everybody?
Just over 3,000.
Public health.
Just over 3,000 students.
So everybody who's a student or an employee will be possibly in that pool to provide the students for the 198 slots.
That's right. That's right. And we've earmarked 10% of the slots for people that work at UAMS or study at UAMS that live within that neighborhood where the Child
12th
Development
Street
Center, right, the 12th Street neighborhood. And we've also allocated 10% of the spots to individuals that qualify for child care vouchers through the Department of Human Services. So we're hoping that we hit a broad spectrum of our UAMS faculty, staff, and students, so that we have the children in the center that are children of students that are still borrowing money to survive, but also hopefully newly recruited surgeons will have their children there as well.
It's a great equity initiative to have that encompass all those different people with different backgrounds. So I guess one of the things that appeals to students and providers is they can cut down the time they spend perhaps taking their children to some daycare before they go to work, because it's going to be right there on their path to work and right there after they get off work. And I guess in some instances, they're working long shifts. How long will the facility be open in the afternoon?
Right. We're going to be open 13 and a half hours
Wow.
a day. So we're open about an hour before the normal Child Development Center and about an hour later than most are open. And it is very...
2 shifts a day for the workers, I guess.
Absolutely. That's the goal.
Approximately how many people will work there?
Work at the
facility?
about 6,000 on the Little Rock campus.
No, but how many people will be at the Child Development Center?
At the Child Development
Yes.
Center, sorry.
'Cause you have two shifts if you're going to have 13-hour days.
Right. We will have about 40 new positions created
there.
with this Child Development Center.
So that's good for the Chamber of Commerce and the economy. The local economy watchers will be happy to hear that. I guess part of the discussion I remember in 2019 was that these kinds of initiatives and projects typically are not self-sufficient. In other words, the amount of revenue generated by the parents whose children are there doesn't cover the entire cost. So the university is making a commitment to subsidize this. Is that the way it typically works?
That's absolutely accurate. We the cost of the Child Development Center will be close to the cost of market in the Little Rock area, but hopefully a little below market. The idea is that this is a benefit to employees, and so we will be subsidizing part of the expense. We believe that that's going to pay off for the institution in terms of retention.
It'll come back to reward you because you'll be able to recruit physicians, you'll be able to recruit staff, nurses, you'll get students maybe enrolled who couldn't otherwise be able to do it.
Absolutely.
So it's a good investment.
I believe it is.
Well, I know it's good for the community down there because the Children's Library is looking forward to it, and we hope to be able to participate in whatever ways we can. I know that you've been over there, and we've talked in the past about ways that we can help, and our staff are excited. I guess Bright Horizons is going to, I think I heard last week, is the largest employee-sponsored facilitator or manager of daycares. Is that right?
That's right.
And they're going to manage it. The university will contract with them to manage the facility.
That's right. Yes, we're planning to move forward with Bright Horizons as the provider of care within the UAMS-owned facility. And they have a very rich curriculum that includes science, technology, engineering, math, all the STEM subjects. But
even for 2-year-olds.
Even for
Especially
for babies.
For 2-year-olds,
exactly.
Right.
So we're very excited about it, and we are excited about the partnership with the library system and particularly the location being across the street from the Hillary Rodham Clinton Children's Library and Learning Center. We believe that all the wonderful things within that library, the culinary kitchen for teaching children about cooking, the greenhouse, the theater space, we believe all those things will be utilized by the children and families that go to this Child Development Center. So we're excited about
It's
it.
a short walk just across 10th Street there. So.
Very, very easy walk.
And I had never actually crossed the street and stood on the lot where the where the facility's going to go, but it's a nice perch. It sits up higher than the street. I didn't realize. The architects told me they were not so happy about that because it's going to be a steep grade down to Jonesboro from where we were standing last week. They will make it work.
Yes, the advantage of that steep slope is that it'll have an entrance on the first floor as you enter, and then that second floor will also be at ground level. So every classroom in this center will open to the outdoors and have playground space.
It has to be great for both the kids and the people who are supervising to be able to get them
Much
outside.
easier.
Yes, right. Yes. So that's all very exciting. When do you think this will be open?
I'm hoping January of 24, but certainly by the spring of 24.
Okay. Are there any other exciting projects that are coming down the pike at the university, med school?
Well, we have so many new buildings that are about to open in the next year. We have Orthopedic and Surgical Hospital.
And that's over by the McClellan
freeway.
Veterans Hospital.
It
You can
is.
see that on 630.
It is. It's
So
spectacular.
that will be outpatient, mostly outpatient orthopedic surgery.
Absolutely. We will have some overnight beds for those people that need to stay 23 hours, but for the most part, outpatient surgery. We also have a radiation oncology center. If you drive up what is now UAMS Boulevard, was Cedar Pine, you can see that building is getting near completion as well and will open.
That's been a long time in coming, right?
It has. We're very excited because it will have a proton beam, first one in the state, and that is being delivered middle of October, so
Wow.
it should be exciting.
So proton beam, as I understand it, is a easier on the patient radiation therapy for cancer patients typically?
Right. The radiation is very targeted, and so hopefully there's less collateral tissue damage when the beam is focused on that spot.
And how long has UAMS been in line to have that option for therapies?
Well, we've been talking about it for 3 or 4 years, but we have partners in this project, Children's Hospital and Baptist, so we're very excited about the opportunity for having this radiation oncology center open soon.
It fits into that mission. I hear it all the time when there's a local public radio station blurb about the university or UAMS. It's, what is it, helping treat people clinically and make our state healthier through education and awareness and research.
Right. Through
I
our
butchered
3
that,
missions. Right, you did great. Through our 3 missions of clinical service, teaching, and also research.
It's a wonderful place, and great that Arkansas has it. And I've just always been grateful as a patient that I now live in Little Rock, not in a small town in southwest Arkansas where I grew up, in which case you had to drive 2 hours to get to this wonderful facility. But people all over the state come here, I know, so it's a great treasure, and everybody's grateful that you guys are there. And we're glad you're doing this Child Development Center. I had a board member yesterday when I reported this to our board who corrected me when I called it a daycare. He said, no, Nate, this should really be a child development center because it's so important. Early education is so important, and Dr. Silhampton is correct about that. So I'm appropriately reminded that it's a child development center and not a daycare facility. Although the daycare part will be something, I guess, of some capacity. It's just if you're there 13 and a half hours, it can't all be instruction probably.
It's pretty exciting.
Yeah.
I agree. Those years are really so impactful in terms of a person's life. So we're excited about the curriculum we're going to have, and also that ease that parents will have having their child very close by and well cared for.
Your 31-year-old may come back and say, why didn't you have this when I was there?
Exactly.
Years ago.
If he knew, he would definitely say that.
Thanks a lot for coming in, and we appreciate you being such a big supporter of the library.
Thank you, Nate. I appreciate it.
Take care.